Dr. Vuong, I'd like to talk to you about missing teeth. Many doctors keep telling us that missing teeth is really a problem and need to be replaced very soon, very fast, pretty much right away. However, as patients who sometimes have missing teeth for a long time, especially in the back, we don't really see major problems. So what is this discrepancy? Can you shed some light on there of why do you guys say replace them, otherwise all hell breaks loose, and we patients don't really see much of a problem?
Well, in dentistry, a lot of the changes that happen in the mouth are not really that obvious to an untrained eye. And what happens when you have missing teeth is you get drifting of the adjacent teeth, and you also have a super eruption of the opposing teeth, which can cause problems with your bite. I always recommend anytime that you have a tooth removed to have it replaced with either a bridge or an implant or a partial denture. And of course, the fourth choice is always doing nothing, which is also a choice. It's not the ideal choice, but it's a choice that a lot of people make as well.
Right. Well, talk to me about, you say, not noticeable to the untrained eye. You must understand that just because a tooth is crooked in the back, I mean, kind of in terms of noticing it with the untrained eye, who cares? What consequences do we have? You say it might damage your bite. What does that really mean? What life consequences does that have?
Well, it leads to poor occlusion. So that means your bite isn't even, and so you're going to get a lot of drifting of your teeth. So that means your teeth are going to start shifting into that empty space, and then of course you can't bite as well, and you can't chew as well, and your quality of life decreases because you can't eat quite as well, and also it also leads to sometimes to periodontal disease. Just because the teeth are crooked, it makes it a lot more difficult to keep your teeth clean, and it creates hiding spaces for bacteria that grow around the teeth.
Okay. All right. Well, I'll get that. So now, however, your quality of life of not eating, that well, this is exactly what we're talking about. Most patients, most people really don't, so to say, notice that. And what you're saying, it seems to be more a clinical thing, but most patients do not consider it being a lowered life style or whatever. Because for instance, take me. When my wife and me sit down for dinner and we have both the same size steak, not that we do, because she gets a much bigger one than I. But anyway, so when I'm finished eating completely, and I think my wife still chews on the first or second bite, literally. So it wouldn't matter how many teeth I have in it. I just swallow. Many people do this type of things. So basically, or they chew on the other side, so they don't really look at it as it being a big problem. So they forget the chewing thing for a moment, because that's exactly what's unreal to us, even though we probably should, but we might not anyway. What else is there? What does this occlusion, what does this shifting teeth, what does this bad, I think when you talk about a bite, is your teeth, the upper and the lower teeth, they're not aligned anymore all that well. What else does that do to us?
Well, what else does it do? If your bite isn't quite aligned, then you get a lot of shifting of the teeth. You start getting spaces with your front teeth.
Okay.
I mean, for some people, it's not a big deal. For others, it's a huge deal. So it just varies from one person to the next.
Okay. All right. Okay. So I'm gonna do